We investigated the same bispecific antibody, XmAb18968, targeting CD38 and having CD3 as a component in patients with relapsed refractory T-cell ALL or T-cell lymphoblastic lymphoma. So CD38 has been investigated as a potential target in T-cell ALL and T-cell lymphoblastic lymphoma for the last few years. The commercially available CD38 targeting drugs in the myeloma space have been investigated in the T-cell ALL space, and there has been evidence of efficacy, and there are ongoing clinical trials from that perspective. What we felt was, given this drug being a bispecific antibody, a good mechanism of action, and CD38 being a potentially targetable antigen in T-cell ALL, we devised this phase 1 dose escalation clinical trial for patients with relapsed refractory T-cell ALL using XmAb18968. So patients eligible for the study were adults 18 years or older. They had relapsed refractory T-cell ALL, and they had to have CD38 expression of at least 20% by flow cytometry or IHC. And we even allowed previous therapy with CD38 targeting agent if a patient has received it, as long as it's more than 6 months prior to the current dosing. We did enroll about 7 patients so far, out of which 6 patients were response evaluable, and the dose escalation is still continuing to progress. Similar to our experience in acute myeloid leukemia, we were able to notice similar tolerability profile in T-cell ALL as well. We did not have any significant dose-limiting toxicity so far at this point of time, although the dose escalation is still continuing to progress. Cytokine release syndrome was also predominantly grade 1, grade 2, and then there were no significant ICANS that we noted at this point of time. The drug seems to be also showing signs of efficacy at this point of time. We have had few patients who have gone into complete remission, and these are patients who are actually starting treatment with a significant blast burden, and then they were able to convert into CR as well. So this was exciting to us, and we are continuing to work on enrolling more patients for this cohort, and then hopefully once we reach the maximum dose, then we'll hopefully understand better the safety profile and also the efficacy profile, even with much more higher number of patients.